Hello, everyone. I'm Dr. Marty Ross. This is another conversation tonight with Marty Ross MD. It's a webinar where we're going to talk about Lyme disease, and we're going to talk about the things that you want to talk about because you create the webinar with your questions. For those that are coming back here again, I see a number of familiar names on my message board, so I'm glad to see you're here, and I'm glad to see you keep getting some value out of this, and I assume that's why you keep coming back at least. For those of you that are new here, welcome. And the way that you participate in the webinar, there's two different ways. One, I will take questions and I'm going to answer them. And so you can listen to those answers. The other thing you do is actually write a question to me. And the way you do that is over on the right-hand side of your computer screen, there's a chat box. And you can use that chat box to write questions to me. You can just write it in the regular chat area. I was having people click on the question mark icon down there before, but you don't have to do it. Just use the regular chat box function to do that. The only thing I ask is, as you write the question, do not click the enter key until the whole thing is done. Clicking the enter key actually sends a complete question to me. And if you try to break it into too many parts by clicking the enter key for each paragraph, it really gets hard for me to follow on this side. The other thing I would mention is try to be shorter with your questions. You don't have to have like a one sentence question, but be a little bit shorter. If these things get really long, it doesn't quite work out for this kind of a format. So I don't want to hear your whole life story in a sense. I want to hear the pertinent things that will help me answer the question for you as well too. Okay. And then I am creating a webinar recording tonight, and I will have that edited, and then I'll do a quick summary of it. And I should be able to get that out to you tomorrow morning, somewhere between 9 or 9:30 in the morning. When I will send an email to you notifying you that it's ready around that time. In that email, there will be links that you can click on to see the recording, but also in that email will be the sign up form for next week's webinar. Okay. So this is the first of 3 webinars that I'm doing this month. So, and they're going to occur in the next 3 weeks. Okay, so each Thursday for the next 3 weeks. I think that's about all I have here. Let me go ahead and get started. One last thing. During the webinar, I will, for those of you that are participating in the live version of the webinar, you have the benefit of actually being able to see the questions show up on your screen. I am going to read the questions out loud, though, so that people can that are listening in on the recorded version can go ahead and follow along with what we're talking about, okay? And then one last thing. Tomorrow morning when I send you the email, share it. Send it to people that might get benefit from the webinar or knowing about these webinars so that they might have an opportunity to sign up for next week's as well, too, okay? All right. So let's go ahead and get started here. Hello, Rebecca. Let's see. Hello, Dr. Ross. You are a superstar. I like you, Rebecca. Thank you. I appreciate that. 2 questions. What is the herbal equivalent of amoxicillin to fight infection? And are you familiar with from Dika's Wave 1 light treatment for Lyme and co-infections? And if so, what is your opinion? So I am not familiar with that specific way of treating Lyme, and so I can't make any comment on that, okay? And then in terms of herbal equivalent of amoxicillin, there really isn't a true herbal equivalent, and let me tell you why I'm saying that. So the way that amoxicillin works, well, actually, let me step back. So keep in mind that the Lyme germ has some different forms and locations that it lives, okay? So Lyme exists in 2 forms. One is the spirochete, that's a corkscrew-looking thing. Okay, you see pictures of that on the internet. The other way that Lyme exists is those spirochetes can morph into these microscopic cyst forms of the germ, okay? All right, so spirochetes and cysts live outside of cells, all right? Lyme also has an additional form that lives inside of cells, and that is something called the L form. And the L form actually gets rid of its covering and just moves inside of cells and lives there, basically, all right? So amoxicillin only works outside of cells. And it has the ability to only work on the spirochete from the outside of the spirochete. It doesn't even get in the spirochete. And the way that it works is basically as Lyme grows, the germ covering develops little damaged areas, and and it's supposed to be able to repair those damaged areas, and amoxicillin prevents the repair of the cell wall of the spirochete, okay? So amoxicillin is a cell wall agent that does nothing for the cyst form of the germ and does nothing for intracellular Lyme, okay? All right. Now, in the herb world, we haven't had studies done that tell us whether things like well, actually, that's not true. We know that things like cat's claw and otoba, which are two of the big herbs I like to use to treat Lyme infection, not the co-infections, but the Lyme infection. And we know from some limited petri dish experiments that those can treat both spirochete and the cyst form of the Lyme. So we know it's working on both, which is more than what amoxicillin does, okay? And then in addition, we know that the other thing that it appears from these petri dish experiments that happen is that these herbs cooperate with each other. And when they're put together, you get a whopping kill that's bigger than each herb individually. And then finally, these herbs have the ability to strip off a slime layer that Lyme uses to cover itself called a biofilm. And amoxicillin doesn't do that either, okay? There is no herbal equivalent of a cell wall agent, all right? All right. The other thing that these herbs do is I assume, although we have no experiments to show it, I assume that it actually gets inside of cells for intracellular Lyme. And the reason I assume that is there's a number of people that get well just doing herbal antibiotics. And the only way they could get well is if I'm reaching and getting those Lyme germs that live intracellularly as well too, okay? So in terms of, is there anything that's directly equivalent? No. Are there herbs that work well and do more than amoxicillin? Yeah. Cat's claw and otoba bark, those are my two favorites. And I like using those to treat for spirochete, cyst Lyme, intracellular Lyme. And then finally, there's some newer research that came out a year ago or so now that shows that the cat's claw has the ability to also treat non-growing forms of Lyme or non-growing state of Lyme, which we call persisters. So these spirochetes and cyst are generally in a growing form or growing state, I should say, state that is. And about 10% of them may take on a hibernating state. And those hibernators don't respond typically to normal antibiotics. But according to research out of Johns Hopkins University from a year ago, cat's claw is one of the herbs that actually has the ability to deal with those persisters, okay? Other herbs that deal with persisters and also deal with growing Lyme would be things like Japanese knotweed, Cryptolepis, which we historically have used more for treating parasites and babesia, also seems to have the good an ability to treat growing and persister forms of Lyme. And then finally, essential oils like oregano, cinnamon, and clove can treat growing Lyme as well as treat these persisters as well too, okay? So one of the things you would notice in my Lyme treatment protocol, the Ross Lyme support protocol, in the section of that protocol where I talk about how you can kill Lyme, I talk about the need to treat persisters and the need to go after the cyst and the spirochete. One way that I recommend doing that is to use cat's claw, otoba, and a liposomal form of cinnamon, clove, and oregano oil, okay? All right. Well, let me show you where you can find that kind of information here to look at this further. So I'm going to do a quick screen share. All right. So this is my Lyme disease information site, Treat Lyme by Marty Ross MD. So there's two ways you could, so take a look at this, my Lyme protocol tab here, okay? And these are my treatment guidelines. And I talk here in this protocol about the key steps you want to deal with to get well. You want to deal with sleep, diet, control inflammation from chemicals called cytokines, help your body deal with stress by being in something called an adaptogen, deal with hormonal imbalance, be on a good multivitamin, take some basic detox steps, exercise if you can. But down in this section right here, section 11, is where I talk about what can you use, okay? And in here, I talk about otoba bark and cat's claw. Those are the two herbs I was just telling you about. And also using liposomal cinnamon, clove, and oregano. Okay. Now, in terms of the liposomal cinnamon, clove, and oregano, the company I like using for that is a company called Dr. Inspired Formulations. And you can find that here. So this is my supplement store. If you're ever wondering, where do you find stuff that I recommend? I usually talk in terms of generics, but if you're wondering what I carry in those areas, you can look here. If you're wondering what products would I use that I find to be high quality, look here at my supplement store, okay? And so this is the Dr. Inspired Formulations page, and this is the liposomal cinnamon, clove, and oregano capsule product I like to have as part of my treatments these days because of persisters, okay? All right. Shoo, that was a long response. The answer is there's nothing that's directly the same as amoxicillin, but you can do good things with the herbs anyhow, okay? All right. Thanks for that question, Rebecca. Let's see. Hello, James. Let's get that posted here. Hi, Dr. Ross. Thanks for answering our questions. You're welcome. You've said before that some people take too many supplements. Roughly, what would you say is the maximum number of supplements a person can take before it becomes clear to you that it's too much? That's a good question. Let's see. What are the problems people encounter when they take too many supplements? Also, with probiotics, roughly, what is the upper threshold in billions of units a person can take before they reach the point where there is no longer any benefit? All right. So, James, what I've talked about, so I sometimes literally have people that come to see me that will bring in grocery bags full of supplements, okay? And it's costly, all right? So it's costly. So, for any problem that you have in Lyme, there are many different things you can take. You can take 2 or 3 different supplements to try to correct any problem. Just because you can take 2 or 3 different supplements to correct any problem doesn't mean you should, all right? And the reason you might not want to take 2 or 3 for any one problem is it gets to be really costly. The other thing you have to keep in mind, the more products you take, even though they're supplements, there still is the possibility of interactions, okay? So in general, I tend to be, I wouldn't call myself a minimalist. I'm probably moderate in my approach, all right? There are some of my colleagues that, for every problem you have, they're going to put you on multiple different supplements. So I'm just giving you my philosophy here, okay? In terms of how many is too many, well, it all really depends on what the problems are that a person has. But I would say if you're probably starting to get up around 10 to maybe 15 or more supplements, you probably ought to really be thinking about, do you need all of those? That's just a general guideline that I would say, okay? All right. And then the problems you can encounter is you start getting into possibly into interactions between these different supplements. In terms of, the probiotics, I often don't talk in terms of billions. I talk in terms of the capsules. So generally, if you're starting to get anywhere between 2 and 4 capsules of whatever the product is, you probably got enough probiotics going in you, okay? That's just my guideline on that one as well, too, okay? All right. Good luck to you, James. Hello, Rich. Let's see, Dr. Ross. Your website where you sell supplements is fantastic. Thank you. I appreciate that. I love the fact that you've done all the work sorting out which supplements are the high quality supplements. Here's my question. From my experience, the Nutramedix tinctures seem to be far stronger than the other tincture brands that I have tried. Do you think this is true? Therefore, would the dosage that you would take be the same if you were to take the Montana Farmacy tinctures? Or would you have to take more of the Montana Farmacy tinctures to get the same effect as Nutramedix tinctures? How does Nutramedix make their tinctures so strong? Are they using a different process? All right. So this is where it gets a little bit tricky when you have different companies. So first of all, Nutramedix has a proprietary system of doing their tinctures. So they don't actually tell any of us what their extraction technique is. Okay. So whenever you're doing tinctures, basically you're putting plants in some kind of liquid to extract the alcohol back out. Okay. I'm sorry. The liquid extracts the chemicals from the plants into the liquid. And that's a way of getting the active ingredients into the liquid. Okay. And then after you create your tincture, you strain out most of the plants. Most tinctures still will have some plant debris in them. Okay. Now, traditionally, most tinctures are made using a 1-part plant to 5 parts liquid or alcohol extraction. Okay. And the strongest thing to use for doing extraction is alcohol. And the higher content of alcohol usually will get you more of these chemicals extracted from here. Okay. Most companies out there that are doing herbal tinctures are doing 1 to 5 extractions. That's what they're doing. Okay. Nutramedix has not told us what they're doing. All right. So it may be a 1 to 6 is one of the things I've heard before. And we don't know what they're doing in terms of their extraction process, in terms of they claim they have a better way of extracting, but we don't know. It's all proprietary. Okay. So in my practice, what I find is that there are some people that are telling me, as I've moved to the Montana Farmacy products, that they find they're stronger than Nutramedix. Okay. And there are other people that find them to be less strong. So it's very individual. And the trouble is the way that tinctures are done, it's not like a pill where you know how many milligrams of the herb is in there. Okay. Extractions are very dependent upon the process that was used to extract the chemicals from the plant and how much gets deposited in the liquid. And we don't go back and standardize the liquids based upon how many milligrams of cryptolepis is in there or how many milligrams of cat's claws in there. Okay. So my experience is, in general, on average, I'm finding that most people are finding the Nutramedix products and the Montana Farmacy products to be pretty equivalent. There are reports I get occasionally, as you're suggesting, that some people aren't finding them quite as strong. Okay. And so the other thing I would say about Montana Farmacy is developing their tinctures following the guidance that Buehner, as in Buehner Herbs, makes regarding how tinctures should be created, which is that standard 1-part plant to 5 parts of alcohol. Okay, that's just kind of the standard. It's a way that Buehner would suggest that herbalists create their tinctures. Okay. So the only thing I can say is make this shift and try and see. And if you don't think it's quite as strong, ramp it up. All right. And the other thing to keep in mind, I mean, the one thing about the Montana Farmacy tinctures is they are about less than half the cost of Nutramedix. Nutramedix is, I don't understand. It just boggles my mind what they charge for their stuff. But again, I think for most people, the Montana Farmacy products are equivalent, and they're going to, at the same dosing, 30 drops twice a day. And generally, they're going to be more than half the cost of the Nutramedix products. Okay. All right. So everyone that's listening in on this too, Montana Farmacy is spelled with an F, not a PH. Okay. So it's Montana Farmacy. I carry a whole line of their herbal tinctures to meet what some people would use as part of a Buehner Herbs protocol. I also was able to work with Montana Farmacy. I requested that they start making an otoba bark extract. That's not part of Buehner Herbs, but it is part of Cowden. And I use it as part of my Ross protocol. So about 2 or 3 months, maybe 3 months ago, they were able to actually finally get some otoba plant, and they're now making otoba bark extract. And I'm having good results with that and working with my patients as well too. Okay. So it's a whole line of herbs that you might use if you're doing a Buehner protocol, and it has the cat's claw and hutania and otoba that would be part of a Cowden protocol as well too. Okay. Let me just do a quick screen share here. All right. So again, this is my supplement store. In terms of, so if you're wondering where do you find these herbs, you could either look under my Buehner herbs protocol page, which basically just has the various herbs in it that Buehner would work with as part of his protocol, or go over here to my Montana Farmacy page, and here is where you're going to see the various herbal antibiotic tinctures that we carry here. Okay. There we go. All right. Good luck to you, Rich. Thanks for the question. Hello, Dave. Let's see. I've been taking the Thorne quercetin phytosome, which you sell on your website. Does this absorb in the body better since it is a phytosome version? Can you go over the difference between phytosome supplements versus liposomal supplements? Which will get more fully absorbed in the body? Thanks for doing these amazing webinars. You're welcome. Thank you. All right. So it's a great question. And so let me just talk about what liposomal means first, and I'll talk about phytosomes. So basically, there are some herbal medicines and supplements that just are not well absorbed, okay? And we find that if you can either mix them in fat or microscopically wrap them in fat, that you get better absorption. When you actually microscopically wrap something within little balls of fat, that's called a liposome, okay? A lot of companies, when they say they're doing liposomal or phytosome, are actually just blending oil from something in with the active ingredient, like a quercetin, to increase the absorption. Because it still will increase the absorption, even if it's not within these little bubbles of fat. So a true liposome is a bubble of fat in which the ingredients that you want to get absorbed are placed inside of it, okay? But what can still work out fairly well is to just mix things up in oil. And a lot of companies will call those, will say they're liposomal, or they'll say they're phytosomes, okay? And that increases the absorption. Now, the phytosome by Thorne is basically fat. It's sunflower oil that they're using as part of their quercetin complex. Now, what I don't know, and I cannot tell from any of their materials, is whether it's a true liposome, meaning it's a way of putting quercetin within these little fat bubbles to get them absorbed, or is it just mixed up? I don't know. I can't tell from the way that they describe it on their website. But the reason they are doing it is that quercetin in general is not well absorbed. Different ways that you can do to increase the absorption is mix it with fat, like the phytosome that they do. And they use sunflower oil to do that. The other thing you can do is taking high doses of vitamin C sometimes will help increase quercetin absorption as well too. Okay. So yeah, anyhow, I hope that answers your question. So I would think phytosome is another way of saying liposomal. That's my interpretation of it. Okay. All right. All right. Let's see here. Hello, Alyssa. Let's see. Hi, Dr. Ross. I started having what I believe is a Lyme flare-up after a series of immune system testing done by our new mold doctor. I feel worse now than I did before the testing and was told at the end that it could flare up my Lyme. I began mold treatment, activated charcoal, about 1 week after my flare-up began. My questions are the following. Do you recommend treating for both the mold and Lyme flare-up at the same time, or do you first focus on treating one before the other? If treating at the same time, will the mold binder also bind the antibiotic for the Lyme? Also, for the Lyme flare-ups, do you normally use doxycycline? If not, what do you normally use? And lastly, how long do you normally treat flare-ups? 1 month, 2 months, or until you feel better? Thank you. Okay, so there's a lot of questions you packed in there, so let me try to see if I can get to them, okay? So first of all, generally, if I'm going to treat somebody for Lyme and or mold, and we haven't been treating for a while, I'm going to start with one first. And I'll tell you how I determine which one. But I usually don't try to start a mold treatment or mold toxin withdrawal treatment and start killing Lyme germs at the same time. And the reason is that killing Lyme is going to cause a Herxheimer reaction, all right? So when you cause a Herxheimer reaction, what happens is the immune system sees the dead bug parts and reacts by having your white blood cells manufacture and make more and release more of a group of chemicals called cytokines, okay? The act of pulling toxins out of your body also triggers more cytokines, all right? So you're killing germs, you're triggering more cytokines. You're pulling toxins out, you're triggering more cytokines. It can get to be too much to begin all at once, okay? All right, so let me talk about cytokines real quick too. So cytokines are good and bad. Cytokines are made by white blood cells whenever they see an infection or whenever they see a toxin in you, okay? And what their job is they're basically the way that the detective white blood cells that are seeing these problems will release cytokines to tell other white blood cells that you got a problem, all right? And those cytokines cause more white blood cells to be made. They draw the white blood cells to where the problem is, and they help the white blood cells work better. Okay, that's all great, all right? But in Lyme, and too many yeast in your intestines, in mold toxicity issues, the immune system will often make too many cytokines as it tries harder and harder to get these problems under control, all right? And too many cytokines make it so you can't think, give you fatigue, disturb your sleep, make you hurt all over, can give you depression and anxiety, interfere with how your hormones work. All right. So when we say somebody has Lyme symptoms, they have too many cytokine symptoms. Okay. When we say somebody has mold toxin symptoms, they already have too many cytokine symptoms. All right. And so when you start pulling the toxins out, if you flare more cytokines up, your underlying symptoms are going to get worse. And if you start killing germs and you flare more cytokines, and we call that a Herxheimer reaction. Cytokine flare due to killing germs is a Herxheimer reaction, okay? That's going to make you feel worse too, okay? So for that reason, I'm usually going to figure out which one of these ways I want to go first, okay? Now, if I've got somebody that I haven't treated before, in terms of helping me to figure out which problem I'm going to go for first, I take a good history, all right? So if I've got somebody that comes to see me and they've got a solid history of a bullseye rash and a tick bite, and they got severely ill, I might think about treating their Lyme first because it seems to me that's probably the tick bite and everything that got them worse. But if I'm talking to them and they say, yeah, and at that same time that I got sick, I just moved into a new house that had black mold on the walls, I'm probably going to go for the mold first, okay? So I try to figure out what thing was happening at the time you got sick and go for that first, all right? So if the history says I got sick after my tick bite and I don't really remember any mold exposures, even if they have testing that says they have mold toxins, I'm probably going to go after the Lyme first, okay? Now, that works in my practice. I know there's others out there like Dr. Nathan and possibly Dr. Krista that would say you always get your mold toxins out first before you go after the Lyme. I just disagree with that because I have good results of going after the Lyme first, okay? The times I definitely go after mold first, though, is if it's clear to me from the history that it's a major mold issue first. And in those situations, for instance, I've had situations where somebody came in, they had positive Lyme testing, they had severe cognitive dysfunction, lost their family because of divorce, because of how bad they were, lost their job, and had solid positive Lyme testing. But the history was he got sick when he moved into a house full of mold. In that situation, all I did was 3 months of mold binders. And guess what? He was completely well. We never had to deal with the Lyme at all, too. Okay. On average, if we can't tell what came first or what was the major cause, in general, I'm going to get started on my Lyme treatment first because that can take longer to go through. And after somebody is stable on their Lyme treatment, then I'm going to start adding in binders to go after the mold toxins. Okay. All right. So I kind of individualize my approach. And as I said, again, I know there are some people like Dr. Nathan, I believe, would suggest always get your mold toxins out first. That's not my experience. Okay. That's not what I see to always be the definite way forward. All right. All right. Then let's see. So, you can, again, after you're stable, whatever you start first, your Lyme or your mold, after you're stable, you can add in the treatment. So if you want to start treating Lyme first with doxycycline, and after a month, if you're stable on it, you're not declining, you're not having herxes, then it would be okay to add in binders and start going after your mold while you keep treating your Lyme, for instance, okay? Let's see, and then you said, also for Lyme flare-ups, do you normally use doxycycline? Okay, so let me talk about that. So when I've got somebody that has gotten well, I've treated them and they've gotten well, and then they come back and they think they might have a relapse because a lot of their symptoms are back. The first thing that I do is to try to figure out whether they might have another reason for their cytokine flare. All right. Remember, I said Lyme symptoms are really too many cytokine symptoms. Okay. So when somebody has been treated for Lyme, keep in mind that even if they were on herbal antibiotics or they were on prescription antibiotics, either one of those can disrupt the good bacteria in your gut. The prescription antibiotics have a greater chance of doing that, okay? But the problem is when you've had disrupted bacteria in your gut, a year, 2 years, 3 years down the road, you might wind up getting too many yeast living in your intestines, okay? And too many yeast living in your intestines flare cytokines up and can make it look like your Lyme or your Bartonella are back again, all right? And what I find in my practice generally is about 80 to 90% of the time that I see somebody that has a supposed Lyme flare or a supposed Bartonella flare, it actually is that they develop too many yeast in the intestines. And the way I figure that out is just take a good history. So the problem with the yeast is we don't have good testing that proves it's there. You've got to work on a clinical hunch, okay? So first of all, we know if you've been treated before with antibiotics, either herbal prescription, you're set up to get too many yeast down the road, all right? So you got risks for that. Second thing I always will ask is, has a person had more sugar cravings? Have they been on a sugar binge recently before they got sick? In other words, did they feed their yeast? Okay. In women, is there any vaginal itching, vaginal discharge? A common thing that can happen if you have too many yeast is they release toxins into the bloodstream that will interact with your skin and can lead to worsened eczema rashes, might even make psoriasis worse, and can sometimes lead to pimples and acne in the skin too, okay? So I'm going to ask questions about that too. And I also ask people if they have something that happens to have sugar in it, do they feel worse? That can be a sign of yeast too. And what I find about 80, probably 80-ish% of the time that somebody comes in thinking they have a Lyme relapse, there's enough symptoms going on and things that make me suspect yeast that I'll treat yeast. Usually within a month or 2 months, they're back on their way again. Okay. All right. So think yeast. Okay. That's one thing I want you to do. All right. And then in terms of what do I use for my flare-ups? If it's just Lyme, I tend not to like to use doxycycline. I tend to like to use clarithromycin, which is Biaxin. And I like to combine that with a grapefruit seed extract. Clarithromycin will work on L-form intracellular Lyme. It will also treat the spirochete form of Lyme that lives outside the cells. And the grapefruit seed extract can go after the cyst form of the germ too, okay? There is some data out of a paper, actually I was just reading it earlier today, out of Johns Hopkins that shows that clarithromycin might even have some persister treatment abilities, although I think there's some things that are better than it, okay? So keep that in mind. The reason I would go with clarithromycin over doxy is it's easier to stomach, and you don't have all the sunshine burning problems as well too, okay? The other thing I would do if I got somebody that is more inclined to go herbal, I might look at doing the otoba and the cat's claw instead too, okay? All right. So I hope that gives you some things to think about there, Alyssa, and good luck to you. Hello, Al. Let's see. Do parasites create a bloated, distended, stuffed sort of feeling in the upper belly region? So in terms of things that will give you bloating and kind of a distended upper abdomen feeling, there's a few things I would think of. Number one, possibly intestinal yeast, although usually that's going to be a little bit lower abdomen, but sometimes intestinal yeast overgrowth will do that. The other thing can be a condition which is known as small intestine bacterial overgrowth, or we call that SIBO for short. And basically what happens with SIBO is you wind up getting bacteria and sometimes even yeast growing in the small intestines. And you're not supposed to have bacteria or yeast growing in the small intestines, right? These bacteria get into the small intestines, they work their way up from the large intestines. And if they're there, they ferment sugar and give you a lot of gassiness and bloating, okay? So that's another condition to think about. And then finally, yeah, parasites might be an option too. My general approach when I have somebody that comes in with these kind of symptoms is to try to do a treatment for yeast first for about a month. Usually I use something called diflucan along with nystatin. Those are prescriptions. The alternative would be to do herbal option, and that would be to do, I like using a combination product of caprylic acid, garlic, and oregano. That product is called Capri Plus, CAPRI, and then plus PLUS, all as one word. Okay, it's a product by Karuna, and that's 2 pills twice a day. If you do that, then 2 months. Okay, try to clear your yeast first. The reason I will sometimes just do it without even testing again is I don't think there's a reliable yeast test out there. If that doesn't work, then your 2 next steps are to get a SIBO breath test and also to get stool studies to see if there's parasites. Often the stool studies will find parasites. They don't always do. Sometimes I will treat for parasites, even if stool studies are negative based on the person's travel history. So if I've got a person that tells me they've traveled the world and they've gotten, and they've been in less developed places and they've gotten frequent episodes of diarrhea when they've been there, I'm going to think, well, they may have parasites there. Okay. The trouble with parasite testing is it can find it a lot of times, but it misses it a lot. And so sometimes I'll just do treatments for possible parasites. But usually I'll do that only if I have first figured out SIBO is not there based on breath test. And I've also taken steps to clear yeast as well too. Okay. All right. Let me, I think I've written some article about this here lately too. Bear with me. I'm going to do a quick screen share here. All right. Let's see here. So I'm going to take a look at my chapter on intestinal health, and I think it's stomach and intestine. So there it is. Okay, so in terms of trying to figure out if you have yeast, take a look at this article called "A Silent Problem: Is It Yeast?" Okay, and then in terms of trying to figure out what your intestinal dysfunction is coming from, take a look at this article called Intestinal Dysfunction, Symptoms, Test, and Treatments, okay? And I go through SIBO, parasites, yeast, leaky gut syndrome. I go through all of that in this article, okay? All right. Here's my article on SIBO. And here's how to kill yeast. Let's see here. Yeah, I think that gives you enough to look at there. Okay. Good luck, Al. Thanks for the question. Hello, Lan. Let's see. Hi, Dr. Ross. I frequently take different combinations of the following supplements: Japanese knotweed, Hutania, Sidacuda, Capri Plus, Andrographis, Liposomal clove, oregano, and cinnamon oil, berberine, and Chinese skullcap. Do any of these interfere with probiotics? Should I separate them? I'm also taking BPC 157 for inflammation and shoulder injury, and it's helping. How long can I safely take it for? Some functional medicine doctors are recommending iodine nasal spray for an added layer of protection against COVID, in addition to vaccines. Do you have any thoughts about this? Any concerns? Okay. So I am not aware of the iodine and why they would do this. I can't make a comment on that. The only thing I would be careful about with iodine is if you get too much iodine, even though we think of iodine as being very helpful for thyroid function, if you get too much iodine, it actually can suppress thyroid function. Okay, so like for instance, if you're doing vitamin that would support thyroid function, you want to make sure that your iodine in there is not over 150 to 200 micrograms. You want to stay under that. If you start getting over that, that can lead to some thyroid suppression and sluggishness actually too. I don't know how to correlate that directly with the nasal spray though, okay, but I'm not aware of why they're using that. I haven't seen any evidence that would suggest that is something that's going to be useful, okay? But I can't comment. I don't know what the rationale is behind that. In terms of the various herbal antibiotics that you're taking and probiotics, so when you take probiotics, the big concern that we have is if you take something at the same time that could kill them, okay? So the idea is you want to basically try to take your probiotics as far away from a germ killer as possible, all right? Now, it is true that prescription antibiotics have a much greater chance of hurting the good bacteria that are in your probiotics, all right? And I know there are some herbalists out there, like even Buehner, I have heard, I think, say that he doesn't really think that you disrupt the gut microbiome on herbal antibiotics. That's not my case. I have seen people that have come to see me on herbal antibiotics that get yeast overgrowth, okay? So it can happen, all right? And there is the possibility that, my opinion is that some of these herbal antibiotics could also decrease the amount of probiotics that you get into your intestines if you take them at the same time. I would separate them. I would try to take your probiotics away from any kind of antibiotic, whether it's herbal or prescription. I will admit, or I will acknowledge, not admit, but I'll acknowledge that prescription antibiotics have a much rougher time or harder time on those probiotics than herbals. But herbals, there is a chance the herbals can have some interference as well too. Okay, all right. And then in terms of the BPC 157, so everyone, what that is, that's a peptide. And it's a peptide. So peptides are, so you're aware of proteins, and then there's peptides, okay? A protein is a long strand of amino acids. Amino acids are the building blocks for protein. There's different kinds of amino acids. You put a lot of amino acids together and it gets long enough, we call that a protein, okay? So a protein is 30 or more amino acids put together, that's a protein. Under 30 amino acids, we call that a peptide, okay? That's the difference between the two. And peptides are substances that are naturally made in the body. So for instance, BPC 157 is actually a peptide that is manufactured in the stomach lining. And it is thought to be manufactured there to help repair intestinal injury further down the stream. We do know that it actually has the ability to help with sports injuries like tendon, muscles, ligaments, maybe even inside the joint. And I am seeing benefit also for people that have neuropathy. So it seems to do repair injured tissue. The other thing that BPC 157 might do is to create a better balance in your immune system between two parts of your immune system, something called Th1 and something called Th2. Okay, Th1 are the types of white blood cells like T cells and natural killer cells that attack a germ. Okay. Th2 is made up of your allergy cells called mast cells. It's made up of something called B cells, or they're the ones that make your antibodies. And it's made up of the cells and cytokines that are involved in autoimmune illness, all right? One of the things that can happen in tick-borne illnesses is we start getting a shift where you have less Th1 and you have excess of Th2. Excess of Th2 releases some cytokines that suppress Th1 and make it harder for your immune system to help you get over the infections, okay? And BPC 157 can help kind of right that ship up, basically, and create better balance, okay? So that's another reason to do it. So, you know, there are no limits that I think you can take this for. In other words, I don't think you have to limit how long you take the BPC 157. That's my opinion. You want to also talk to your own physician because I cannot be your physician. Okay. I'm just talking about in general how I recommend it to my patients. But in the cases of actually you deciding what to do with something, talk to your doctor, because I don't know all the nuances of your healthcare. Okay. All right. Thanks for that question, Lynn, and good luck to you. All right. So for those of you that are wondering about these peptides, there are a number of doctors that are offering injectable peptides, and then there are some that are available orally. The injectable peptides, the FDA is starting to step in and regulate that, and it's getting harder and harder to have them, to be honest with you. I'm primarily working with the available oral peptides. And let me just show you what we've got here. So there's a company called Integrative Peptides. And they currently are making 4 products. One is this body protection compound, also known as BPC 157. That's what I was telling you about there. Standard starting dose on that is 1 pill a day. Okay. They have another peptide compound called Can't Wait that is intended to help with weight. Another one called CerebroPep. This is a mixture of something called cerebrolysin, which can help with thinking, basically, okay, and cognitive function. And then they have this TB4 frag. Now, they recently have gone out of stock on the TB4 frag, and they now have a new product called TB4, I think, Frag Max or something. It's a new one. I'm still waiting to hear from them as to whether that new product is going to replace this one. And their new TB4 Frag product I will be getting soon. I just need them to answer some questions to me about it. Okay. Anyhow, TB4 Frag is something called thymosin beta 4, which comes from your thymus gland and also can help balance that Th1 and Th2 inflammation that I was talking about. Okay. All right. If you want more information about what those different peptides can do, read the product descriptions on each of those products. I did try to build a description into those about the things that can be supported by being on those peptide therapeutics. Okay. All right. Thanks for the question. Hello, Alyssa. Let's see. Also, can mold toxicity, Bartonella, or Babesia cause your ANA blood results to come back positive? I previously tested negative and I just tested positive, level of 1 to 40. Could this be a false positive? I recently began having what I believe to be a Lyme flare-up and some immune system testing done. Not sure if this has something to do with it. Okay. So ANA, everyone, is a blood test that stands for anti-nuclear antibody. All right. So it's antibodies. They're measuring that you're having some antibodies. All right. And these happen to be antibodies that are made against what is known as the nuclear material of your cells. All right. So the nuclear material is basically the center of your cells that is composed of the genetic apparatuses, like your DNA and some of your RNA is inside the nucleus. All right. All right. So basically, your body is starting to attack its own genetic material. All right. That's what an ANA means. Okay. The thing is, though, some people tend to label the ANA as the lupus test. Okay. Because it often is abnormal when you have lupus, but a variety of things can trigger it to occur, all right, of which Lyme can be one of those. And often getting Lyme under control will get that back down again, okay? So just having an elevated ANA does not mean you have lupus. And in this elevation, this is actually a very low level elevation. This isn't a real high elevation. But yeah, Lyme could do that possibly, okay? All right. Good luck to you, Alyssa. Hello, Jules. Let's see. Hi, Dr. Ross. I've been treating Bartonella for a few months, and now it seems my symptoms are shifting. Now I'm having migrating joint pain, stiff neck, nightmares and shortness of breath. I had a positive IgG PCR for Lyme and positive FISH for Babesia. Is the shift of symptoms a sign that Bartonella treatment is working? Do you think adding Cryptolepis and Cascol to my regimen of clarithromycin, alicinin, and liposomal oregano oil could be enough coverage for Lyme and Babesia? I couldn't figure out if this would cover all the forms of Lyme. I'd like to avoid otoba and Japanese knotweed due to alcohol, phytoestrogen intolerance issues. Okay, so let me try to tease this out just a little bit. So first of all, maybe make a comment. The clarithromycin, alicinin, liposomal oregano is a way that Dr. Mozignani, who is one of our leading experts on Bartonella, is now currently designing his Bartonella treatments. All right. And I know last week's webinar, or 2 weeks ago when we had our webinar, people were asking me if that's the only way to treat Bartonella. No, it's not. It just happens to be his way of treating it. Okay. There are many ways to treat Bartonella, and I don't know that his way here is any better than any of the other ways. All right. So I'll be glad to show you an article that I've written about that. I know one of the concerns previously, he'd been talking about using a lot of rifampin and rifabutin, especially clarithromycin, rifabutin, and maybe methylene blue. He has some concern that using the rifampin and rifabutin was leading to adrenal fatigue. I don't know that I agree with that. So anyhow, I'll show you my article here in a little bit that gives you the various ways that you can go after Bartonella. All right. Now, the other comment that I will make to you is that when you treat Lyme and tick-borne infections, and clearly this looks like you have a Bartonella regimen here. That's what the clarithromycin, alicinin, oregano oil would be. Okay. I do want to let you know the clarithromycin would treat intracellular Lyme and spirochete Lyme. The oregano could pick up persister Lyme. The only thing you're missing from a Lyme germ standpoint here is that you're not taking anything to treat the cyst. And then a simple way to add treatment coverage for that would be to do grapefruit seed extract. It's a 250 milligram pill, and it treats the cyst form of the germ. Okay. And then, so I don't know enough about your Bartonella symptoms, but I can tell the regimen's a Bartonella regimen. I know you've told me that you have positive FISH testing for Babesia, and FISH test, everyone, stands for fluorescent in situ hybridization. It's a mouthful. What it basically means is that we take your blood and we take some fluorescing agents that attach to Babesia. And if they do attach to the Babesia, we can see them. Okay, so it's a way of making it so we can see your Babesia. So if your FISH is positive, it means you're not just measuring an immune reaction, you actually are seeing the germs. Okay, so you've got some Babesia by testing here. And then the PCR for Lyme, that means they're seeing the genetic material of Lyme in you, which probably means you have Lyme in you as well too. All right. So what I find in people that have multiple infections, sometimes as you clear the layer of one infection away, the other infection symptoms will start popping up. All right. So if we look at the symptoms you're having, migrating pain tends to be a symptom that we see with Lyme. It's very unique to Lyme. So migrating pain and migrating neuropathy, those symptoms seem to be very unique for Lyme. Okay. The stiff neck is often something we see with Lyme. Nightmares could be Lyme or Bartonella. Shortness of breath could be Babesia or could be Bartonella as well too. Okay. So part of the reason you're seeing these may not be that you're getting worse per se. It's just as you've peeled one layer of your onion, what's under it is coming out. All right. And so I would probably take some time, talk to your healthcare provider and find out what they're going to do to help you start addressing the other infections, because you don't need to just limit your treatment to doing Bartonella first. All right. You could be doing Bartonella and add in grapefruit seed extract, and suddenly you have a full Lyme treatment here as well too. To turn this into a Babesia treatment, it is possible that adding in Cryptolepis would do that. Cryptolepis is historically we use for Babesia. More recent research that came out of Johns Hopkins University suggests that it can treat persister Lyme and growing Lyme as well too. Okay, But we don't know from that research whether it goes after your cyst. So if you choose to use crypto and add grapefruit seed extract in here, just realize if you choose crypto to get better Lyme coverage, I still would add in grapefruit seed extract. If you were my patient, that's what I would recommend, because you got to get at the cyst form of Lyme, okay? And yes, it is reasonable to think of doing crypto in a situation like this, because if that shortness of breath is more of a babesia symptom, it should start helping with that as well too. The other thing to be aware with crypto is it can help with Bartonella. All right, so it seems to go after all three germs, to be quite honest with you. But I'm going to turn you back to your Lyme doc. You should talk to them so they help you figure out, based on your whole history, what's the next germ you should be adding in while you continue to treat your Bartonella. Okay? All right. Good luck to you, Jules. Hello, Margaret Lee. Let's see, is artemisinin and contraindicated with rifabutin? My daughter stopped Malarone so she could start rifabutin, but her babesia treatment was not finished, and I worry any progress made will be undone. Is there any other prescription antimicrobials that she can take while on rifabutin and azithromycin for BART? She did not tolerate coartem. She also takes Crypto Plus, Alcornia, and Sida acuta. All right. So in terms of treating the babesia, the reason that the rifabutin may interfere with the metabolism of atovaquone that's found in the Malarone. Okay, so that's probably why your physicians decided not to keep doing that. All right. In terms of other prescriptions that you could take a look at, that you could do along with rifabutin and azithromycin for babesia, you might want to take a look at using one of the quinolines, which could either be something called primaquine or something called tefenaquine. I'll show you an article about those. You can take a look at that, okay? The tefenaquine probably is the way I would go, but it can be hard to get your hands on right now, all right? Primaquine may have some more availability, all right? Now, but you said, is there any, so I think the way you wrote this question, you said, is there any other prescription antimicrobials you can take while on rifabutin and azithromycin for BART? I'm wondering if you mean for babesia. All right, that's why I'm saying you might want to consider adding a quinoline in. And quinolines would be primaquine or tefenaquine, okay? If, on the other hand, you're wondering what else you can add to a rifabutin, azithromycin regimen for Bartonella, that's what you wrote here. You know, the Cryptolepis that you're using in the Crypto Plus can help. The Sida acuta that you mentioned here can help with Bartonella as well too. Okay, all right. So I'm gonna do a quick screen share. I'm gonna show you an article about babesia treatment, and I'm gonna show everyone an article about how to treat Bartonella. The options that you have for that as well too. All right, so bear with me. I'm gonna bring up a screen share here. All right, so so in terms of how to treat babesia and Bartonella, take a look at this infection treatment plan section here. All right, and in terms of what to use to treat babesia, your options, take a look at my article called Kills Babesia, a Brief Guide. And in fact, my commentary is it's not getting to be so brief anymore because I keep adding to it. But anyhow, in here, I talk about I've broken these into different tiers. Okay, so tier 1 are the treatments that tend to work best. Okay, so tier 1 treatments, I break into either atovaquone-based treatments, which one of those would be your Malarone you were just on, okay? And I also break them into quinoline-based treatments, of which you could look at a primaquine or a tefenaquine. Okay, that's what I was just mentioning to you, okay? All right. And then for Bartonella, take a look at my Kills Bartonella, a Brief Guide. I just updated this back in a little under a month ago, and I now include some things about a fibrin nest in here, but also about using diflucan as part of a Bartonella treatment as well too. Okay, so anyhow, down here, I list out many different combinations of things you can use to treat Bartonella. Although Mozignani is very fixated right now on alicinin and oregano and clarithromycin, I just want to be clear, there are so many different ways you can go after Bartonella. And what's a good treatment is what works in you. All right. And there's many options that you can use here. Okay. All right. All right. Thanks for that question. Hello, Margot. Let's see. What do you do for anemias? Are there common types from Lyme and co-infections? So I would say there are not common types from Lyme and co-infections. So the approach to anemia is work it up. Try to figure out what your underlying cause is. All right. So that means getting your blood count. And if you do have low blood levels, then then the next step is pay attention to something called an MCV. That stands for mean corpuscular volume, which is the size of your red blood cells. Okay. And we break anemia into three categories. We break it into normocytic, meaning you have normal sized blood cells, microcytic, which means they're small, and macrocytic, which means they're big. Okay. If your MCV is high, then you should look at getting a folate level and a vitamin B12 level. All right. If either one of those are low and you have anemia, giving B12 or folate will help raise up your blood counts. Okay. If you have a low MCV, that means you've got microcytic anemia. That usually is due to low iron. So you need to do measurements of iron. And that a good one would be to measure something called ferritin, which is the storage form of iron. And if it's low, you would start replacing iron, but then you have to ask, why is it low? Okay. So if you're a woman, it usually means that you're having heavy periods. All right. But if you are not having periods because you're either at that stage in life as a woman or you're a male who doesn't have periods and you have low iron, you have to start wondering, is there a place you're bleeding within the intestines? It could be from a polyp. It could be from colon cancer. But people need to work you up to figure out that you're not having a source of that loss of iron, basically. Okay. And then finally, in Lyme, if you have a normocytic anemia, you have to start wondering, is there something you're taking from a medicine standpoint that could be suppressing your bone marrow, making it so that your body isn't adequately making red blood cells? So you have to look at the drugs you're on and have your doctor go through them with you and say, could this be suppressing my bone marrow? Okay. So for instance, Bactrim is a sulfa antibiotic, can suppress the bone marrow. Dapsone, which is part of Horowitz's protocol for persister Lyme, can suppress the bone marrow. Okay. So we have to look at those things and figure out it could be coming from what we're giving you, basically. Okay. All right. Good luck to you, Margot. Hello, Victoria. Let's see. Dear Dr. Ross, in your article about disulfiram, you mentioned treating a person who had chronic Lyme for 20 years, but never took a prescription or herbal antibiotic with disulfiram alone. After nearly 8 months of treatment, she was almost completely recovered, 100% of health. Question 1, did the patient have co-infections of Bartonella, like Bartonella? Question 2, what was the targeted tolerated dose of disulfiram and how soon was it reached? And question 3, what were the symptoms, usual, unusual, and at what point of treatment did the patient start noticing improvements? Thanks a million, Victoria. All right. So I'm going to actually probably be in the next few days updating that disulfiram article, just so you know. I'm in the process of actually taking all of my articles about germ killing and republishing them as my book on my soft cover book, but trying to publish it in a form you can actually carry a book around, right? And as I do that, I'm reworking a number of the articles and updating them. And so next up, I've been doing a lot of reading today on disulfiram in the last few days, and so we'll be updating that article. the one big thing I want to talk about with that is in that article right now, I have said that the data, the science behind disulfiram only supports using it to treat persister Lyme, and that the science did not support treating growing Lyme. Okay, so again, Lyme terminology. Let me go back to that here for a minute. Okay, so we think that back in 2015, we first discovered that Lyme doesn't just have a growth state; it has a persister or hibernator state. Okay, so about 90% of the germs are in some form of growth, and about 10% go into hibernation and they ignore standard antibiotics. Okay, we call those persisters. The hibernators are called persisters. Okay, all right. Now, in the and then in terms of the forms of the germs, we have spirochetes. That's the corkscrew-looking thing, and the Lyme can morph into these microscopic cyst forms. Okay, now spirochetes and cysts exist in growing states, and they can become persister states. Okay, so I just want to talk about terminology there. Okay, so disulfiram, when it first came out, the first paper that was published about it was written by the doctor that discovered disulfiram. His name is Rohadas, out of Stanford University, and in his published paper, he did note that they found it was useful against persister Lyme, but he mentioned nothing in his one paragraph description about it treating growing forms. Okay, so historically, I had always said there's no data that shows that it does anything for growing. Okay, however, I missed a paper. I missed a paper that he published in late 2019 where he actually went further and did some further studies on it. And actually, his studies show that it may have the ability to treat growing Lyme as well too. Now, more recently, about a year ago, maybe a year or 2 years ago, after this second paper by Rohadas, Dr. Ying Zhang in his lab at Johns Hopkins started looking at using disulfiram in combination with things, and also looking at what combinations of drugs might be good to treat persisters, including looking at studies using disulfiram. And in the Hopkins studies, they actually did a comparison of disulfiram and various drugs that can treat growing Lyme, and disulfiram and various drugs that can treat persisters. Their studies, the Hopkins was a laboratory research, okay? And they actually showed it's not the greatest persister killer, although it works, okay? Rohadas' study makes it look like it's a great persister killer. The one out of Hopkins says maybe not, okay? But in the Hopkins study, they actually compared and gave data that really shows that it can kill growing Lyme. But in terms of how strong it is, it's kind of in the middle of various things that we can use. It isn't something that I would grab for as my agent of choice to treat growing Lyme, okay? All right, now the reason I'm saying all of this is in this article that you're talking about is I describe that I only recommend using disulfiram to treat a persister, not growing, except that I have the experience of one patient in my practice who said she still wanted to be on disulfiram alone anyhow, and she got better. And I questioned based on that if maybe disulfiram does treat growing Lyme. So I want to let you know, yeah, it can treat growing Lyme, and I'm going to be updating my article to reflect that. Okay. Now, does disulfiram treat Bartonella? No. And we have some solid evidence of that out of Johns Hopkins from about an article published about 2 or 3 years ago now. My clinical experience says it does not treat Bartonella either, okay? And most of us that treat tick-borne infections do not find it useful for treating Bartonella, and so we don't use it for that, okay? She did not have any symptoms of Bartonella, all right? Whatever her body weight was, we wound up using the maximum recommended dose for her body weight on disulfiram, okay? So I dosed it based on her body weight. I think it took maybe 2 or 3 months for her to work up to that dose, and then she was there for 4 months, and it did work well for her. Okay, all right. Now it took, I believe, at peak dose about 1 to 2 months for her to start having improvements. Okay, Now, let me just say a few things about disulfiram. So yeah, you could use it as a solo agent to treat growing and persister. It's possible, okay? I will tell you though, it's a hard drug, all right? I think there's better ways to go at treating growing and persister Lyme than using disulfiram. First of all, from the studies that case reports that of a series of about 70 people that Dr. Ligner treated in his practice, he published a study about his outcomes, right? And he showed that basically 30% of people were able to get into some form of extended remission, okay? That means 70% of people did not, okay? So as in terms of being a very effective drug, it maybe can help about 30% that way, all right? But there are great risks at using it, all right? So about 30% of people that are on it will develop some kind of psychiatric problems, and sometimes those can be severe, okay? About 50 to 60% of people that take disulfiram will wind up having some degree of severe fatigue just being on it, okay? And then finally, there's about 15 to 20% of people that get neuropathy. Now, the problem I'm finding with the neuropathy is that in a small percentage of people, it becomes permanent. So even when people get off the disulfiram, they're left with damage from it, okay? So disulfiram is not an easy drug. And I think there's other things that we can use to treat persisters and growing. I outline a number of those in my protocol, my Lyme disease antibiotic guide. I give you other options to treat growing and persister. I would take a look at those, all right? But if you do want to use disulfiram, be aware it probably can treat growing and persister. On the growing side, I think it's a weak treater of growing. In my patient's case, it seemed to have worked very well, okay? And be aware if you use it that you could develop permanent nerve damage. I just have to tell people that these days, okay? I've seen enough problems with people, actually people that have come to see me that were working with other practitioners that come in with permanent neuropathy from this. So be careful when you're using it, okay? All right, I'm gonna show everyone. So just keep your eyes out. You'll see an email from me if you're signed up on my for my newsletter at my Treat Lyme site. Probably sometime early next week, you'll see a re-release of my disulfiram article because I am going to be updating it to reflect that there may be some ability for it to handle the growing form of Lyme as well too. Okay, all right. Good luck to you, Victoria. Hello, Robert. Hi, Dr. Ross. I have been taking one pill every other day of liposomal cinnamon, clove, oregano oil formula for about 3 weeks. This was due to the extreme herxing at the recommended dose after 2 or 3 weeks. At first, I was herxing on the off days. That has tapered off, and I am at mostly level toleration. I'm getting benefit, and it may be good to increase my dose. Would you suggest 1 pill a day, 2 pills every other day, or stay where I'm at for a while? I want to reach the maximum benefit. Thank you for all your help. All right. So Robert, so first of all, yeah, I mean, there are some people that I find that the liposomal cinnamon clove oregano is strong. It does some really big germ killing, and you get Herxheimer reactions from it, okay? So keep in mind, again, what a Herxheimer is caused by is your immune system sees the dead germ parts and manufactures and releases a lot of cytokines, all right? So one thing you want to make sure that you're doing, in addition to looking at how you dose it, is make sure you're doing some adequate things to control your cytokines, all right? So one of the hallmark things I like to have people do is liposomal curcumin. That's a product by Thorne. It's called Mariva 500 milligrams 3 times a day. And if I've got people that are having difficulty with herxing, I will go up to 2 pills 3 times a day, which is 1,000 milligrams 3 times a day, okay? So what curcumin does is it gets inside of your white blood cells and it interferes with the factory line producing cytokines, okay? All right. All right, so the second thing I would do is get also on some liposomal glutathione. So liposomal, again, means it's microscopically wrapped in fat. Glutathione is notoriously poorly absorbed, okay? But liposomal glutathione, the product I like for that is by Research Nutritionals. It's a product called Trifortify. They've got some really good studies proving good absorption of it, and it's well absorbed, okay? And I would do a teaspoon of that, which is about 400 milligrams one time a day, all right? The reason I would use glutathione is, again, curcumin gets inside of the white blood cells to limit the factory being able to produce cytokines, all right? But the factory has to get an order from outside, all right? And what glutathione does is it interferes with the order to produce cytokines reaching the factory, all right? Specifically, it's a good antioxidant. And when you start killing germs, it's the release of oxidizing agents by the immune system that triggers, that tells the white blood cells, that orders the white blood cells to make cytokines. So glutathione is a powerful antioxidant, lowers that oxidizing agent trigger. In addition, as you start killing germs, you're going to release germ toxins, and they need to be cleared. And so glutathione helps your liver with detox of those toxins as well, too. All right. So first part of handling this isn't just managing the dose. It's doing things to manage your Herxheimer reaction. Okay. So 1,000 milligrams 3 times a day of curcumin, 400 to 500 milligrams 1 time a day of liposomal glutathione. Okay. All right. That, if you were my patient, and you're not, so I'm just saying theoretically here. Okay. Again, I can't create a doctor-patient relationship with you because I've never examined you. All right. And ultimately you should talk to your own doctor about this. But if I had a patient in your situation, I would instruct them to go ahead and start taking it, move to 1 pill once a day. And after they are tolerating that fine, then probably go to 2 pills, alternating with 1 pill every other day. So 2 pills one day, 1 pill the next day. All right. And then from there, try to go, I'm sorry, what am I talking about? I would go to 1 pill 1 time a day next. Okay. All right. And then after you're stable on that, I would go to 1 pill in the morning, 1 pill at night, basically from there. Okay. That's what I'm talking about. All right. All right. Good luck to you, Robert. All right, so for those of you that are wondering, I've mentioned cytokines a few times here tonight, and I've talked about what you can do about them. Take a look at my Herxheimer and cytokines section here. And take a look at this article called Control Cytokines, A Guide to Fix Lyme Symptoms in the Immune System, okay? The reason I put the immune system part in here is too many cytokines suppress your immune system too, all right? So take a look at this article here, okay? Hello, Margaret Lee. Let's see. Question from Margaret Lee. Is artemisinin... Oh, we already talked about... No, did we talk about that? Oh, I answered this question, but I forgot to answer the part about... All right. So, Margaret, I answered your question earlier, but there was one part that I didn't answer here, which is artemisinin contraindicated with rifabutin? I'm not aware of any contraindications on it. Okay. All right. Good luck to you. Hello, Karen. Let's see. What's the best way to treat MRSA in the sinuses? Is gentamicin dangerous to use in the sinuses? So I want to be clear on terms here. Okay, so MRSA stands for methicillin-resistant Staph aureus. There is also another condition that sometimes people get with that some people associate with mold toxicity, and I question that association, but some people associate with it, which is called MARCONS, which stands for methicillin-resistant coagulase negative staph. Okay. So they're two different things, okay? In terms of how to treat MRSA in the sinuses, if that's what your question is about methicillin-resistant Staph aureus, I don't know. I have to look at it. I haven't had to deal with that in a long time, so I'm not sure what the best way is to do that, okay? Good luck to you. Hello, Lauren. Let's see. Is the InfectoLab ELISpot test for Lyme and co-infections a solid test? It's a good question. So everyone, InfectoLab is a lab here. It's called InfectoLab Americas, or of the Americas, I believe. They are offering a T-cell activation test, which is also known as an ELISpot. Okay, so let me talk about the technique, and then I'll answer your question. So many of you are aware of Western blot and immunoblot testing that's offered by IGeneX. Okay, what IGeneX is doing is they're looking to see, does your immune system make antibodies that attach to the germ? Okay, so immunoblot and Western blot testing is an immune reaction test, and it focuses on antibodies that are being made. Okay, what an ELISpot test does is it looks at another part of your immune system called your T cells. Your T cells are what actually attack a germ, versus antibodies get stuck on a germ and they serve as a signaling device to the T cells to come in and attack the germ. Okay, all right. So we can tell if your T's in a ELISpot or a T cell activation test, what we're doing is we're trying to see if your T cells have ever, the T cells in that test tube, have they reacted against Lyme or Bartonella or Babesia, whatever one we're testing for, okay? And the way the test is conducted, basically, is we take your blood, we take your T white blood cells out, we put them in a test tube. And then we wind up introducing into that test tube proteins from the Lyme germ, or if we're looking for Bartonella, proteins from Bartonella. And we see, do the T cells react? And the way we measure reaction is we measure certain cytokines that they make. And if they make high levels of cytokines, that means they react against that germ. Okay, now, the thing about T cells is we have circulating T cells in our blood, and then we have memory T cells. For the Lyme testing that InfectoLab is doing, they're measuring the reactivity both of your circulating T cells, and they have the ability to measure the reactivity of your memory T cells, the ones that are kind of hidden away in the body, all right? Keep in mind that most of your T cells are circulating T cells, okay? And circulating T cells only live for 2 months. So if your circulating test is negative, it means that you probably don't have an active infection. That's if the test is accurate, okay? But in theory, it means you don't have active infection. If your memory ones are active, it could mean you had old infection, okay? All right, now, the problem with the InfectoLab test is for Lyme, they're only doing a T cell activation test for Borrelia burgdorferi. We now know there are many more strains than Borrelia burgdorferi. So for instance, the main European strains are Borrelia afzelii and Borrelia guerinii. Those European strains have now worked their way across the pond, and they are sitting out on our East Coast. And the amount of Borrelia afzelii and guerinii here in the States is growing. Okay, all right. But the thing that makes the IGeneX Western or immunoblot better by comparison is their immunoblot is looking to see if you have antibodies against 8 strains. Keep in mind the InfectoLab is only effective at looking to see if you have some T cell activity against Borrelia burgdorferi. So the other thing about ELISpot testing in general is if we look at quality studies that are done about T cell testing, it will miss infections about 15% of the time. Okay, so it's wrong about 15% of the time. In terms of the InfectoLab Bartonella test, they're only looking to see if you have Bartonella T cell activity against Bartonella henselae. And we think that there are actually 15 kinds of Bartonella that can infect people and give them problems, okay? So their test is limited in that it doesn't test for enough things too, okay? So if you're looking for the better quality test, although it's more expensive, I would lean towards IGeneX. Their immunoblot for Bartonella picks up antibody activity against 15 kinds, and their immunoblot for Lyme picks up antibiotic activity against 8 kinds, okay? So it's probably a more accurate test for you, okay? All right. Good luck to you, Lauren. Hello, Heather. Hi, Dr. Ross. My CD57 is 12 and my doctor had me start transfer factor multi-immune to raise it. Is this a good approach? I'm a little confused as to whether I should try to boost my immune system or try to suppress it. I'm very reactive to everything. All right. So CD57 is a very specific type of natural killer cell. Okay. One specific type. Natural killer cells are a type of white blood cell. There's T cells, there's dendritic cells, there's macrophages, there's lymphocytes, there's natural killer cells, and then in the natural killer cell line, there is this one called CD57. Okay, all right. And we think that it is low if it's under about 150. About 80% of people that have Lyme will have low CD57s. But be aware, there may be other things that cause low CD57s that are not Lyme related. So viruses might do it, for instance, too. Okay. All right. Will transfer factor multi-immune help raise? Your doctor may be thinking, I want to raise that CD57 to help you fight Lyme. All right. Keep in mind, Lyme is being fought by many other cells in your body that have nothing to do with the CD57. Okay, CD57 is just a marker. All right, it's your T white blood cells that are actually fighting Lyme, not your CD57. It's your T white blood cells that are doing that. All right, the transfer factor multi-immune is designed to only raise your natural killer cells. I don't think it's designed to do anything for T cells. Let me double check that here real quick. We'll look at it together here in just a minute. Let's see, I got to do a screen share. All right, so I'm going to go to, so the company that makes the, actually, let's do it this way. I'm going to type in transfer factor. So the transfer factor multi-immune is this product here. And in terms of, well, actually that's true. Okay, so it is designed to promote natural killer cell activity. It's to help activate your macrophages and your neutrophils, so other kinds of white blood cells. And actually it does promote healthy T white blood cell function as well too, okay? So yeah, I mean, if I look at that in theory, it should help with your immune system in general. Your doctor is thinking that because your CD57 is low, that perhaps you have low immune function across the board. That may or may not be so. Okay, I just want you to know. Just because you're reactive to everything doesn't mean that it's coming from your T cells, your lymphocytes, and your macrophages. I don't think it's wrong what your doctor is trying to do. I'm not sure it's going to benefit you, but I don't think it's wrong. Okay. All right. Good luck to you, Heather. All right, everyone. That's it. We're at 5:30 here, my time. That's an hour and a half I've spent with you. I've enjoyed it very much, but I have got other activities to go on into in my life here tonight. Keep your eye out in your email tomorrow morning, somewhere around 9 or 9:30 in the morning. Usually is when I get everything completed in terms of the edits and the summary of the webinar. When you get that, help me reach people. I'm trying to help as many people as we possibly can here. So feel free to share that email that other people can use the links to look at the recorded version of this webinar tonight too and learn about these webinars, okay? Also, in tomorrow's email, there'll be a link that you can sign up for next week's webinar as well, too. And I hope you'll join me for that. So I've enjoyed being with you all here tonight. I hope everyone has a good evening, and I look forward to seeing you next week. Good night, everyone.